Hello, everyone, and welcome to this panel presentation on challenges facing Syrian refugees in Jordan, the pressures from a pandemic. This is being organized by the World Refugee and Migration Council to talk about the particular pressures caused by COVID-19 on Syrian refugees in Jordan. We're going to begin with some opening comments from our honorary chair, His Royal Highness Prince El Hassan bin Talal. And following that, I'll introduce the panelists in the program. But welcome to everyone. We have a Q&A button in the bottom of your screen. Please feel free to submit questions throughout the panel discussion, and then we'll come back to those at the end. But for now, His Royal Highness, Prince Hassan.
Thank you so much. I really appreciate your introduction. I'd just like to start by saying that despite the recognition of the increasingly robust evidence base on the importance of refugee reintegration as a long-term developmental issue, policies towards refugee populations globally frequently adopt short-term emergency response models in what are all too often protracted displacement crises. The work of the WRMC in challenges facing Syrian refugees in Jordan, pressures from a pandemic, make it very clear that the contribution that the refugees have made, and indeed as a host country has made, to their well-being is as valuable as the assistance that we have received from the international community and the UNGOs and NGOs who are working with us. But I feel that we need to develop some form of a synergy between these different silos, institutional silos, if we are to focus on putting human dignity, whether refugees or nationals, locals, at the center of our concerns. At the refugee level, the document which I recognize in front of me looks at the outcomes of the pandemic itself and the consequences of states' responses to pandemic on refugees, livelihoods, health, and prospects of return to Syria. Unfortunately, the research shows that the security, economic, and health situations in Syria discourage refugees from seeking return, with only 150,000 doing so in 2019, leaving more than 1.36 million Syrian refugees in Jordan, according to Jordan's official figures. I would like to say that I noticed the interview on France 24, no, I believe it was on RT, with the the deputy foreign minister of Syria a few days ago, and I personally lament having had a personal relationship with the former foreign minister Walid al-Muallim, his death, which was announced yesterday. I know they are keen to come to terms with the issue, particularly after the Damascus conference, but of course the political walls are still quite formidable. I would just like to emphasize that as a result, refugees, as some of the most vulnerable members of society, remain disproportionately affected by so many factors, and most evidently at the moment, the pandemic itself. At the macro level, the research explores the economic effects of the pandemic on the economies of Jordan and Syria, noting its destructive consequences on the latter, compounded with the costs of violence and instability. In Jordan, the fourth largest host of refugees per capita in the world, according to the UNHCR, the pandemic and refugee crisis have placed tremendous pressures on an economy that is already struggling because of regional instability. The region of which we speak, of course, is the Levant region, the Mashriq region. Limited natural resources, high unemployment rates, overburdened infrastructure, declining economic growth rates, and the effects of government efforts to control the pandemic. The report looks at three themes: Syrian refugees in Jordan with a particular focus on return, impact of COVID-19 on Syrian refugees in Jordan from the refugee perspective, and Syrian refugees and the consequences of COVID-19 in Syria and Jordan. While doing a remarkable job at conveying the struggles and points of view of Syrian refugees, WRMC has also succeeded in conveying the burdens faced by Jordan as a host country. With this report, WRMC provides governmental decision makers, activists, non-governmental organizations, philanthropists, multilateral development banks, and the private sector with evidence-based data. As the call to action published recently by WRMC reminds us, the issue of refugees is a global one, with the need for obligations to be shared, including financial contributions and resettlement and other expressions of solidarity based on the principle of common but differentiated responsibilities. I also remind of the need to have a holistic approach to supporting the host states, moving towards comprehensive development on the national level, including adopting a water, energy, and food nexus on which many of us have been working with the American University of Beirut initiative in this regard, and thinking in response to challenges of existing natural resources. And I welcome a conversation with ESQA early next week. I re-emphasize that WRMC's calls on international agencies to increase their support for capacity building in host governments at the national, state, and municipal levels to administer funds and to incorporate a focus on collective outcomes in their programming and reporting is an expression of will, which I hope one day will be expressed by an ECOSOC that represents the Levant region, an economic and social council. The WRMC has called on regional development banks to provide more concessional financial support to countries hosting refugees. And I'm at the moment looking for the participation of Pascal Lamy, who is the author of the call for a Middle East development bank. And I hope when I find him that I will find his enthusiasm unbent in terms of this issue. A bank that focuses in human capital, a bank that focuses on the dignity of the human being, a bank that focuses on the necessary path to be taken from humiliation back to human dignity. International solidarity is not only needed to fight the pandemic, but it is also needed to wage peace. I thank you very much for your kind attention.
Thank you very much, Prince Hassan, for the remarks. The World Refugee and Migration Council was started in 2017 with the goal of examining the current weaknesses in the system and proposing bold solutions to transform the system. One of the themes of the council was the need for more effective responsibility sharing, and particularly to provide more support to those countries on the front line, such as Jordan, which are assuming a disproportionate responsibility for carrying and protecting refugees who've arrived on their borders. With the support of IDRC Canada and CUSO International, we embarked on a research project to look at how the international community could use non-traditional means to mobilize more support for host countries like Jordan. And then the pandemic hit. And so with the support of colleagues, we refocused the research to begin by looking at the particular impact of the pandemic on Syrian refugees in Jordan and on Jordan itself as a host country. This is part of a larger research project that will be continuing over the course of the next year that will look in more depth at ways the international community can be more supportive of host countries, particularly countries hosting Syrian refugees. But today we're going to present the research from this project we've been engaged in since about April this year with 5 talented and wonderful researchers from the region. It's been a real joy to work with them and the different perspectives that they've brought. So I'm going to introduce them all at the beginning and then perhaps to have a conversation with each of them about some of their main findings. Now, this is an amazing task to ask researchers who spent months and written pages and pages of analysis to summarize their results or some of the key findings, but I'm sure they're all up to the task. We're going to begin with Dr. Rasha Istaiteyeh, who is professor of economics at the Hashemite University in Zarqa, Jordan. Her research is focused on the particular impact of the pandemic on Jordan's economy. She'll be followed then by Arub El-Abed, who is a senior researcher and co-investigator at the Center for Lebanese Studies in Amman, Jordan. She's been assisted with her colleague, Nusayba Shabbatayeh, who has also contributed to the research. And then we'll turn to Omar Asfour, who's a medical doctor and a public health researcher and practitioner who's been engaged in the Syrian humanitarian response since its early phases. And Hossam Alaham has worked with him in preparing the report on what's happening in Syria in terms of the impact of the pandemic. And so we'll begin with Dr. Rasha Istaiteyeh. Welcome. We're very glad to see you and look forward to hearing about how has the pandemic affected Jordan and particularly Jordan's economy.
Yeah, thank you. And I welcome you all, His Royal Highness, Prince Hassan, and all the people from WRMC. I'm glad to be here with you, and just in order not to take much time because we have only 1 hour, so I will be straightforward as an economist. You know, I know only numbers, and so I will stick to that matter. To start with is, let me first tell you that the economic story of Jordan. Well, Jordan is a developing country, is an upper middle income country by World Bank classification in the MENA region. And Jordan is well known for its scarcity of resources, as Prince Hassan has introduced somehow about Jordanian economy. It's an oil importer dependent country, mainly from Saudi Arabia and Iraq. But Jordan has an affluent human capital. Its Human Development Index, the HDI, scored 0.7 out of 1, and it's ranked 102 in 2019. So this is an overall of the Jordanian economy, but with the advent of coronavirus, things started to look gloomy. The government of Jordan, since the beginning of the health crisis, have tightened its precautionary health procedures, curfews, lockdowns, in order to prevent spreading it in the country. And it really succeeded at that time, okay? But during that period of health success, which was from middle of March until end of August, this is the period of the research we have covered, there were an economic hardship on the other side. Jordan's 70% of the GDP is based on services. We don't have a big industries sector. We just only have SMEs and some moderate agricultural sector. So the sectors that were really affected were service sectors, mainly the tourism sector. The tourism sector accounted to 20% of the GDP. That was the previous year. And now we have a losses of 46% of employment in tourism. And in the first 5 months of this year, until May, we have a losses of tourism income accounting to 48%. Of course, there are other deteriorations in the GDP. There was a slump in the 4 months of 2020, a decline of the GDP by 5% in comparison to the year before of the same period. Revenues in the public budget, we usually, the revenues account to 30% of the GDP in terms of collected taxes and fees. Rather, there is a decrease in these revenues due to decreasing consumption, declining purchasing power of the because of the pandemic. So we have a shortfall of about $2.3 billion that represents 6% of the GDP. Other things, we have an unemployment rate which has hit 20% in just the first quarter of 2020, although we have the previous year, the whole previous year, we have an unemployment of just 19%. Of course, remittances, Jordan is famous with its expatriate, Jordanian expatriate. The remittances have decreased in the first quarter of 2020 by 5.4%. Generally, remittances accounted to 10.3% of the GDP the last year. FDI, of course, has dried up, etc. So with the Syrians already in Jordan since 2011, and with the corona now, the pressures started to increase, and the international help was needed in order to fulfill two things for the Syrians. is to have a safe haven for them in Jordan and to have a protection space for them and to sustain such protection for them. And that was through the international community was there with the help of the UNHCR in collaboration with the Jordanian government through the Jordan Response Plan for Syrian Crisis, which is a three-year duration plan. And we have until now 5 successive plans since it started in 2015 until 2022. These plans mainly aim to cover all the aspects for the Syrians, refugees, education, health, livelihoods, protection, shelter, etc. But the amounts for funding in these response plans were somehow adequate in the beginning of the Syrian crisis. But recently, with COVID circumstances, there has been a drop in these financial assistances. It's been reported that around 81% shortfall in the recent Jordan Response Plan 2020-2022. Of course, there are several reasons we can explain such a drop. A part of it, or some of it, is to adopt a self-reliance for the Syrians themselves in order to push them back, to return back to Syria. So Syrian refugees in Jordan have now the risk that the economic conditions due to Corona will not improve for them for 2 reasons. The first, that they might catch the disease, and until September of this year, there were only 2 cases detected, but afterwards it's now becoming to spread the virus in the refugee camps. And the other thing that these Syrian refugees have the risk is that the Jordanians themselves have witnessed setbacks in their incomes, in their savings, etc. So for Syrian refugees, this risk is surrounded by, okay, we are having limited work permits already in the informal sector. We have a temporary work agreements. We have a poor working conditions. So they have this fear of shrinking international assistance in the future, and the situation might prolonged for more years coming ahead. So there are hazards of increasing instability in Jordan might be, and in the region, which is inevitable. So for Jordan, in order to exit such a crisis, it must take the opportunity to maximize, as we call it in economics, maximize the benefits of having Syrian refugees on its land. First of all, Jordan must upskill the Syrian refugees' skills in the agriculture sector with the help of the international donors and international community to improve this sector, to have the required capital, improve the agri-tech, okay, and other innovations, but with no citizenship rights for Syrians. Because the Jordanian people, they will not work in this sector. They've never been before in it, and they will not in the future. It's something have with the socio-cultural mentality of Jordanians, that they are more profound of improving their human capital in studying and etc. So for Syrians, they just need a basic salary to cover their livelihoods. The other thing Jordan must focus is to accept also the Syrian refugees to work in the construction sector. Again, this sector, Jordanians will not work in it, not before, not now, not in the future. So the fear of crowding out effect will not be there. And to open some window for the Syrian refugees to have their involvement in some services that Jordan's economy require, and again, Jordanian people is not working in them. At the same time, Jordan must concentrate in implementing its Jordan Strategy Vision 2025 that requires the requirements and the involvement of 3 partners, the society, the private sector, and the public sector, in order to ensure equitable growth in Jordan. Thank you.
Well, thank you very much, Dr. Rasha Istaiteyeh. It's good to set this context of the pressures on Jordan. We'll turn now to Arub El-Abed from the Center for Lebanese Studies, and Ahmad, who's going to look particularly at the impact of the pandemic on the livelihoods of Syrian refugees in Jordan. Please, you have the floor, Arub.
Thank you, Elizabeth. Great to have you all here, and it's a great pleasure to have also His Royal Highness with us in this. The main concerns for Syrian refugees since they arrived in Jordan in 2012 have been securing safety, family unity, finding ways to sustain themselves and their families, and ensuring better future. Definitely, the cash assistance and the accessing to services that were secured to them through the Jordan Response Plan mattered for them. It mattered because it secured for them the basic rights, but not necessarily all the rights that they need to survive with. The pandemic, as a result, has caused an alarming increase in their livelihoods risks, since the majority of the refugees depend on their daily income for creating a living for themselves and for their dependent family members. That was the major thing that we could trace from 35 interviews we conducted via phone with Syrians who are distributed all over Jordan. In Jordan, we have 1.3 million as per official figures, and we have 58,000 refugees as per UNHCR registration. These refugees are distributed all over the kingdom. We have in the northeast of Jordan 3 refugee camps, where you have 10% of the refugees are living up there, and the rest are living in urban settings. And that is very much the issue when we're looking at the pandemic and how it fired back on them, particularly when they were living within urban settings with limited kind of attention and care, especially that they were all dependent on informal sector for their everyday life. So during the COVID-19, most people had to work through their human, financial, and social assets to make ends meet, given their limitations on mobility and need to acquire daily income. Based on that, we decided in this research to use these capitals in order to unpack their everyday life and to understand the challenges that they encountered when they were trying to secure the basic income for their families, when they were trying to secure the education for their kids, when they were trying to secure water services, particularly in refugee camps for their households. So we used the DFID analysis of the sustainable livelihood. And in the interviews, in our questionnaires, we tried to shape our questionnaires around these 5 capitals, aiming to understand and how they manage to maneuver around these challenges and how they manage to act as a community in order to support each other, realizing that, especially during the lockdown, the support from the outer setting, particularly the government, was very limited. And we give the example, for example, in our study, how Jordanians were definitely affected. Vulnerability amongst Jordanians was very clear. And the Jordanian government, through the Ministry of Social Development, tried to ensure certain support for the vulnerable people, particularly those who are wage workers. The Syrians, unfortunately, were completely excluded out of the services and out of the attention that was given by the ministry, by the Jordanian government. This takes me to how we managed to just unpack these livelihood strategies. And through, first of all, we tried to look at the range of strategies to sustain themselves over the course of displacement, particularly, as I mentioned earlier, with them working long hours, with them having very low status and very low pay. Very important point, just to build on my colleague's talk, on Rasha's talk, because she was very much supporting the fact that we need to upgrade the Syrians within the 3 limited sectors that were open for them. Now, Jordan Response Plan and the Jordan Compact managed to secure work permits for Syrian refugees living in Jordan. The only thing that we need to understand is that these openings that were created for the Syrians were very much limited within 3 sectors: the construction, exactly what my colleague mentioned, and the agriculture and the services. What is sad about it is that that limited people to apply to work permits only to be within these sectors, provided that they are only limited to work within the one company that will ensure them, that will be the guarantor for them to get the work permit. Many of the Syrians and the majority of those that we interviewed in our research proved to us that they did not have an interest to apply for work permits. This, as a result, left them open for exploitation, even during the pandemic, left them very vulnerable. And this is one of the things, major things that we sought to analyze in our study, the vulnerability that affected these people who were already vulnerable. And a third group, also those who were professionals with degrees, with education, who failed to find any access to employment, were also vulnerable the same way those who were uneducated. So that very much has put both groups, whether living within Western Amman or whether living within a refugee camp, in the very same lot, because of the vulnerabilities and because of the limited access to services and to support that they were able to get. I think, in a nutshell, this is the basic thing that we managed to trace: the problem of employment. The second problem that we also were able to hear people talk about it so loudly was the problem of housing. Lots of people failed. We need to remember that the lockdown was for more than 2 months, and for these months, they were unable to get their daily wages. Lots of people were unable to stay in their homes. Some managed to reflect to us the support of the solidarity of the Jordanian people around them, who very much accepted them to not pay their rent but stay at the houses of the households. Yet it's very important to understand that the problem of housing has been a major issue in our study that was reflected to us by all the groups that we interviewed all over Jordan. This is a very second important point that was raised. And the third point was accessing services that we managed to trace, particularly for those who were living within the refugee camps, where water was definitely a major issue, because water was only pumping once a week. And for them to make sure that the water comes into their houses, they need to leave the houses, go to the water reservoir and open the handle. Doing this kind of faucet opening and coming back was not possible because of the lockdown. That was very much of an issue they reflected to us. There are many other issues. To just wrap up, and I believe this is just to close it up with something that talks also to the Jordanian society, which is the online education. Lots of Jordanians have been very much loud about the fact of online education and failing to secure technology, the devices for their kids, whether is it a television when I have 5 kids at home, or whether it is a device, a laptop or an iPad or a phone, in order for my kids to listen to the platforms that were secured by the government of Jordan for these kids. That was very much of an issue loudly addressed by the Jordanian society. So how can we imagine how Syrians are very much encountering this same problem with very much of a risk that they don't have the possibilities and the means to be able to access such kind of devices. So online education, despite it's quite praised in Jordan, amongst these vulnerable groups with the very limited means that they had definitely reflected to us that it is very much endangered, with the risk of these people not pursuing their education. And that's it, really. Thank you.
Thank you very much, Aru, for bringing up this important dimension of how the pandemic is affecting the everyday lives of Syrian refugees. And we'll turn now to Dr. Omar Asfour. As you know, there's been a lot of talk about return to Syria, including this week inside Syria. But tell us how COVID-19 is impacting the lives of Syrians, particularly in the parts of Syria to which refugees might eventually return. And I remind participants that if you have questions, just put them in the Q&A box at the bottom of your screen, and we'll turn to them after the next discussion. Thanks. Dr. Asfour, you have the floor.
Thank you, Dr. Ferris. Thanks to His Royal Highness Prince Hassan bin Talal. Yeah, we have heard a lot of interesting findings about this side of the borders, but actually what's happening on the other side of the borders actually is also, I would say, expected to have an impact on refugees' intentions to return to Syria. To Syria, yes. So just to present a little of a context about the situation in Syria after 10 years of conflict and brutal conflict. Actually, we entered this year with some estimates that suggest that around 80% of Syrians inside Syria is actually below or living below the poverty line. We have heard a lot of reports about high levels of food insecurity. We also know about the continuous devaluation of the Syrian pound. Living costs continue to increase. Income sources, wages, job opportunities all continue to decline over the past decade or so. Supplies, clean water, electricity, fuel, I mean, all these have been disrupted over the past few years. So all this has an impact on the situation here, and of course has an impact on health systems, of course. And on top of that, actually, healthcare system, due to continuous attacks and destruction throughout this conflict, has been significantly weakened. Actually, one of the characteristics of this, unfortunate characteristics of this conflict has been the systematic and deliberate attacks and targeting of health and healthcare. We use the word weaponization, where actually targeting healthcare has been used as a weapon, denying some people, vulnerable populations, disadvantaged population, denying them their basic rights, including health services, has been used as a weapon to push them into one direction or another, unfortunately. We know that actually we entered the year 2020 with a health workforce, health facilities, health infrastructure has been completely depleted, destroyed. We know that we had several years of sieges for different parts of the country, which again completely destroyed and disrupted the healthcare infrastructure. So we entered this year, as we are speaking now, we actually have more than one healthcare system, more than one healthcare structure. Actually, we have at least three fragmented health systems with zero collaboration, coordination between these systems in different territories across Syria. Of course, this has an impact on, again, the capacity to respond, whether to a pandemic such as COVID-19 or any other actually pandemic. So, and of course, we've seen over the years a lot of outbreaks happening inside Syria, especially polio and measles. So, what happened actually in the COVID-19 situation? As we well, first case of COVID-19 has been reported around March in one of the territories, mainly in the government-controlled areas, actually. Later on, during this period, we had another case in one of the regions. We also had another case in around July in northwest Syria. As we are speaking now, actually, after almost 6 months of reporting the first case inside Syria, we are having around I would say, only officially 6,500 confirmed cases in government-controlled areas, with an estimated number of 350 deaths. We have also around 11,000 cases in northwest Syria with an estimated number of 90 deaths, and we have also around 6,000 cases, confirmed cases of COVID-19 Northeast Syria with an estimated number of 150 deaths. Of course, I mean, this is a small number, and these are all official numbers, but unofficial estimates is really higher than this. One significant indicator actually is the number of completed testing. So all over Syria, in different categories, in different territories and different systems, we have only completed less than 80,000 PCR tests or COVID-19 tests. And as we know, PCR test is really an important tool for outbreak containment. Positivity rate is really high. I mean, it's positivity rate is the proportion of positive tests out of all completed tests. And WHO is actually recommending a maximum of 5% of testing positivity. But in Syria, when we look at the numbers, we see in government-controlled areas, we see around 17%. In Northwest, we see around 22%. In Northeast, we see around 43%. And all these are actually very high numbers. And what does this mean? This means that we are seeing a large transmission, so many undetected cases, and it also goes along with unofficial narratives about really a large outbreak that has not been documented. So we talked to humanitarian practitioners inside Syria. And again, we also looked into some of the literature, and some of the estimates based on excess deaths and based on satellite images suggest that as of July, I mean, there were around 40,000 cases, and this is at the time was around 10 times the official numbers. We also had a lot of unofficial narratives from humanitarian practitioners about so many people having COVID-19 symptoms, so many of them actually refusing to go for testing, some of for different reasons, lack of trust. Sometimes they just, excuse me, sometimes they just don't take it seriously. And sometimes they seek testing, but actually there is no capacity for testing. So they are turned away for one reason or another. In some areas, there were some, very limited number of PCR testing kits, and there were very limited number of available tests. So it was really prioritized for very high risk groups, for very severe, for patients with very severe symptoms. So generally, the capacity of health systems inside Syria now is really limited, and this is reflected on the COVID-19 situation. We know that testing kits are not sufficient. We know that ICU beds, ventilators are not sufficient. We also know that personal protective equipments are also inadequate. We heard a lot of story about healthcare providers and health workers who deliver services to COVID-19 patients without any kind of protection. It's just they don't have any kind of protection equipment. Now, generally, again, I mean, we know. Well, I mean, the situation is really tough there, and we know that there are a lot of inadequacies, and we know that humanitarian agencies, they are trying really hard, different territories, different governance structures trying to fill in these capacities, but unfortunately, till now, the situation is not really promising. Now, how does this impact the intentions of return for Syrian refugees to Syria? And actually, this is the part of the question where I will leave my colleague Hassan to respond to this part. I hope he's with us, Hassan.
Hassan, are you with us?
Okay, so possibly we lost him for some technical difficulties. Okay, so actually, from what we did over the summer, we found that again, we know that there are a lot of reports about intentions of Syrian refugees to return to Syria. Now we know, for example, 3/4 of Syrians in Jordan intend to return at some point in the future. We also know that actually in one of the estimates, there were around 5% who already have returned to Syria. And some reports suggest that refugees are actually going to Syria and then come back to Jordan, and they try to secure some sort of permission for this kind of free movement. We also know that according to our refugees and the data we collected, that many of refugees actually might think or consider the return to Syria for different reasons, including economic pressure faced here in Jordan, and some, limited opportunities here in Jordan. Well, some of them before the recent economic crisis in Syria, many of them thought, okay, they might have better economic prospects in Jordan. Now, again, what we find is the majority of refugees in Jordan are really reluctant to return now. Due to uncertainties beyond the border. Now, these uncertainties might be economic uncertainties, and also can be security uncertainties. And I quote, I end my my presentation with a quote from one of our interviewees, and who said, refugees who have returned to Syria actually must have enormously compelling reasons to do so. Otherwise, it's unlikely that Syrians would want to move back to Syria voluntarily right now. And with the COVID-19 situation, with what they are hearing about the COVID-19 situation, it's becoming actually less or more unlikely. And to add actually one more thing about the weaponization of healthcare, I've mentioned this term, and we know that healthcare has been weaponized during the conflict and used as a weapon. And actually, we're still seeing this kind of pattern, some areas within Syria. And this has an impact on the refugees decision, actually, because most of refugees who are in Jordan right now is coming from areas where, is actually underserved, or I would say neglected. Now, I wouldn't say it's on purpose or not. We don't have an evidence, but at least they know from their contacts that the situation in their areas is not really good, whether it's in terms of health services or other basic services. And if we look, actually, there's the very significant number we can look at, which is the positivity rate in these areas. We really can see high disparities when we look at the granular level in terms of testing and positivity area. We can see certain governorates, certain areas within Syria, which have very high positivity rate, up to 50% actually in some areas, which gives us some indication about the situation inside Syria. That's it, and thank you so much for listening. Dr. Ferris.
Oh, thank you very much. It's very illuminating to see these three different pieces and how they fit together. We'll turn now to some of the questions that you've been submitting, and I'll invite my wonderful colleague, Diana Reyes, who's been an integral part of this project, to read some of the questions. I understand, Diana, that you have one question at least for each of the participants, as well as one for all of the participants. I'd also invite Nusayba and Hassan, who, if they're online, to be able to make additional comments in this time that we have remaining. But Diana, over to you.
Thank you, Dr. Ferris, and thanks to all of our excellent panelists. The first question is for Dr. Rasha. Has the per capita income been affected by the presence of refugees in Jordan? And what is the total international debt of Jordan, and has the country defaulted recently?
Easy questions for you, Dr. Rasha.
You think so? Well, primarily the GDP per capita, the income per capita has not been affected by the crisis, because the GDP per capita has something else to do, has nothing to do with the refugees in a direct way. So it was almost around $4,000 US per year during the last, since the pandemic, since 2011, since the Syrian pandemic. So the GDP per capita was not affected directly with the presence of the Syrian refugees here in Jordan, because it has nothing to do, it's another story, has not much to do with the Syrian refugees in Jordan. The second question for the debit of international debit of Jordan, the external debit of Jordan. Well, for the year 2020, I can tell you until June, the external debit was about 33.4 US dollar billion, of course, $billion in June. You know, every quarter we have some estimates, so we have to wait until the year ends and we can have the general amount of the external debit of Jordan. But until June 2020, it's 33.4 billion US dollar. What is that? Is that the questions until now, or is there?
That's right. Thank you. The next question is for Professor Urub. What has been the charity's response, and I assume maybe the broadly humanitarian response in Jordan?
I would like to answer this question, Dr. Urub, if I may.
Yes, I wanted to give you the other one. Please go ahead for this one.
Yeah.
Thank you, Nusayba.
So, in regards to the charities during the pandemic, unfortunately, we haven't heard we haven't gotten any answers from the refugees during the questionnaires that say that the charities have helped. They have only referred to some of the Islamic charities giving only food packages to their doorstep. And these were only, I think, 5 cases. And I think the best, the ones we've heard most about was the INGO's help. We've heard that the UNHCR e-vouchers have secured the basic needs of the refugees, and it had helped them cover the rent, which has been a very it was challenging for each of the refugees outside of the camps. But in regards to charities, unfortunately, there hasn't been many reported help of the charities.
Just to add one point, just a month after the lockdown, it was UNHCR that created a fund, inviting whoever is interested in putting donation in that fund. And it was building up. Like I remember in June, I did look at it. So it was building up so slowly, but it was getting some money and it was allocated. So whoever was donating was very much allocated. Where would the money go? So that was the UN trial or initiative in order to support the Syrians during the pandemic. But no, in reality, there was very little. Bear in mind, we had Ramadan, whereas we had really the month where Muslims do seek to put their charity, their zakat, during the month of Ramadan, and that coincided also to be during the pandemic. I'm not so sure, Nusayba, were you able to trace any kind of input during Ramadan for the charity of the Muslims?
This also was not reported. I think that the thing that we were able to see is that like families and neighbors were supporting each other through like food packages and like monthly, like minimum amount of money, but there hasn't been any zakat. Yeah.
Okay. Useful to know.
Thank you for those insightful answers. The next question is also for Professor Urub and Nusayba. Have you found that Syrians working informally continued to work during lockdown periods because they had to, or was this simply impossible for most?
Nusayba, please.
During the lockdown, it was impossible for any of the, even the Jordanians themselves to work. But after the lockdown, any of those who had any informal jobs, like jobs at restaurants, etc., they return to their jobs, but there has been a decrease in their wages and the numbers of hours they work. Yeah.
Great, thank you. Just based on research, we were not told that, but while working on this report, I had to attend a few meetings held by Tamkeen, which is a body that takes care of the migrants in Jordan, and of course the migrants does include the word refugees. And they reported that there were a few cases, and I cannot really say few, but 50 cases, as they reported, that where Syrians were, during the lockdown, they were locked down in factories. So they were imprisoned within their factories and they were working. So during lockdown days where we were unable to drive in the roads, people were locked down in their factories working, and of course exploited by the payment that they were given. And that was a case, several cases reported, because we had a hotline, and I was attending a hotline by Tamkeen. It was seriously reported. So unfortunately, some Syrians were working in a very bad conditions, working conditions, unable to go back to their families for 2 or 3 months. But the majority of the cases were not working. Just to answer Katarina.
Many thanks.
Thank you.
To both. Last question for Dr. Omar. Are the health facilities coping with the needs of both citizens and refugees? Please elaborate. And perhaps you can also comment on the prevalence of COVID-19 among Syrian refugees in Jordan and how it's being dealt with.
Just to make sure I understand the question correctly, you are referring to healthcare facilities inside Jordan, right?
That's right.
Okay, so well, I'll start with the prevalence. Actually, I'm not up to date with the latest numbers, but my most updated figures, actually, we have around 500 cases between refugees or among refugees, or confirmed COVID-19 cases. Now, as far as I understand, there's no discrimination in terms of treating or responding to the COVID-19 till now. So we haven't heard, or I don't know, I'm not aware of any issues related to treating Syrian refugees inside healthcare facilities in Jordan. Now, to be honest, I'm not in a position to actually comment on the capacity of healthcare system, but what we know is that healthcare facilities inside Jordan is still within its capacity. This is what we all know, and we are still in a good shape according to the Ministry of Health information. But I don't have, I mean, most of my work actually is within Syria. It's not in Jordan. Most of my involvement with the COVID-19 response.
Okay, well, thanks to all of you for your comments, and also for being disciplined and speaking such a short length of time. I encourage everyone to read the full reports because there is a lot more in there. But in closing, I'd like to ask His Royal Highness Prince Al Hassan Al Tibal to make some closing reflections as we wrap up this webinar. I think you're muted, Your Royal Highness.
You're shaking your head, Rob. Do you not hear me?
Okay, now we hear you. Yes.
Okay. For the third time, I don't have a soft voice, but I'd like to think that the social determinants affect every single one of you when you speak about a situation in a particular country. Representing, as you do, a Center for Lebanese Studies, Rub, I take strong exception to your saying Syrian workers were imprisoned in a factory. Actually, I happen to know about that particular instance, and I happen to be able to assist in releasing them from that particular imprisonment. But I want to tell you that in terms of the social determinants, I'd like to thank what Omar Asfour said, that there is no discrimination when it comes to the social determinants we like to think, but that the World Health Organization in the Eastern Mediterranean has set up a commission which is to look at the social determinants of global health. So please bear in mind the social determinants of global health. We don't know where the people came from. We assume that they came from certain areas. We assume that their standard of living was depressed. We assume that they did not have the adequate lifestyle which might have meshed with what we would like to see. But these are assumptions. So I would like to invite you to look at how we move from the status-based approach to the vulnerability-based approach. And that is so important. Secondly, 19 UNGOs have been meeting with me at least on a bi-monthly basis, and I recognize the work of every single one of them. I recognize the work of WPF, which has found out in detail what the take-home pay, the severance pay, the quality of air, the quality of water, the individual requirements. They have humanized the stats. You never mentioned WFP. You haven't mentioned that 98% of refugees have ATM. And you haven't mentioned that we have mobile libraries and we have mobile ATM facilities for conference purposes. And of course, you've done extremely well given the information that was made available to you. But I just wanted to tell you that the question of lockdown is not some kind of draconian measure that is taken against the populace. The result of the lack of lockdown, you might observe that today's cases are 6,450. So put that in your pipe and smoke it. I mean, that is basically what we're facing, this extraordinary idea that somehow the economy of Jordan is the Ruhr Valley or the Rhine Valley economy, and that we're all producing for the whole region. We are not. And that the alternative is social protection. Yes, that is the alternative. We have to focus on social protection because that is all that we have. But for social protection, we have to develop a clear database, knowledge base, which doesn't talk about Syrians in one breath and Jordanians in another and Palestinians in a third and Iraqis in a fourth, but it recognizes that this tiny country has 59 different nationalities in it as we speak. And that we are, when I said the fourth country, forgive me, the first country in per capita that has quadrupled, 4 times we have quadrupled our population since the 1990s. It is this tiny country that is providing whatever it can to Syrians, Palestinians, or whomsoever. And the pressures are mounting. I mean, the question of Palestinian refugee assistance being threatened. I mean, I was delighted to hear that one of the prominent candidates who may well be in government, if there is a government after the 20th of January in the United States, is talking about restoring assistance to Palestinian refugees. So we've become a sort of, I don't know, political push me, pull you. If we don't respect our human dignity, who's going to respect it? And when I say that, not Jordan, not Syria, not Lebanon, not Palestinians, not Iraq, not Egypt or Turkey, all of these countries have to realize that whether education, health, welfare, economy, unless we pull together as a Levant region, there is no hope. And I thank you very much for being so clear, Dr. Rasha. There is no hope, Rasha Istaiteyeh, for us to get into the league of the $35,000 per capita, which plus, which is basically what Israel is. Israel is everything that it wants to be any time of the day, because that's the way, you know, the cards will be pulled out of the Pandora's box. You know what happens when you open Pandora's box? Trojan horses come out of it. And the Trojan horses that we are seeing at the moment are basically sort of going like this. Are we going to live or are we going to die? There, you know, the respect for human dignity in our part of the world is lacking. And maybe we're thoroughly responsible for it. But either we are ugly Arabs or we are ugly Muslims, or we are somehow the enemy outside the fortress of Europe and the United States, or China and Russia and the industrial world, we have to develop a Eurasian context in which the Levant is central. And this Levant is Syrian, Palestinian, Jordanian, Israeli, if and ever they want to be, in terms of respecting international law. And of course, the other countries which are today living on a knife edge. I mean, we don't know what's going to happen between now and the 20th of January, not because we are constituents of the United States, but because we have to look somewhere else to be told what is going to be decided. Is it going to be war? Is it going to be peace? So I want to suggest to you that we have to consider very seriously the concept of crisis prevention in the future. Develop a template of what we understand in incontrovertible facts that apply to every single one of us, regardless of the social determinants of our contribution. We are not important. What is important are the people who are suffering. And in that context, I just wanted to mention the question of people refusing to go for testing. I just wanted to go back to those social determinants of preventive health. Now I'll show you my age. In 1965, I received the first health report by Humboldt University on health in Jordan. And they said, put all your money in preventive health. What have we done? We have gone from one profiteering operation to another in which even health has become a money for profit exercise. Despite that, I thank you, Omar, for your references to the Ministry of Health and the responsible role they play. I would say that in the first phases, certainly, there was some discipline. But again, the spike has been characteristic of so many countries and so many communities, and is very difficult to determine or foresee. But I do think that we are going to a situation where the three big issues with which I'm currently involved. One is water. Every drop of water that we get comes from outside. Two is human dignity, by which I mean refugees and migrants and the need for a new definition of human dignity on that road, as I said, from humiliation to dignity. And the third issue, I think, is the definition of region. As I said, the three letters that determine our present and our future are territoriality. Are we talking about Jordan? Are we talking about a part of the West Bank? Are we talking about northwest Syria? Are we talking about a fragmented, balkanized region? Or are we talking about the Levant? It is the stability of the Levant that is going to determine what happens in the future. And this Levant region has to be promoted, as I said, by conversations between countries in the region. This is why I'm welcoming the Economic and Social Commission for West Asia on Monday, I think it is, to a conversation. We'll give you the links. And I'm welcoming a regional webinar on the situation. Of course, we extended invitation to the Syrian minister and the Omani minister. We had to change the dates, and of course, they were not convenient for their schedule, we were told. But it is terribly sad that the officialdom does not meet on a regular basis. I mean, ECOSOC should meet every day of every week or every month at the undersecretary level, at the secretary level, at the ministerial level, and then have summit conferences. But to be told, come to New York to discuss the future of the refugee system after it has collapsed, without understanding how the refugee system can be put together in terms of component parts, focusing on the central theme of human dignity, focusing on absolute truth, and an information system that supplies us all with the necessary information. Recognizing that the World Bank cannot continue to hide under the title political economy of refugees. I won't touch that. No, this is part and parcel of the human challenge that we all face. So it's territoriality, identity, to which we've referred heard so many times on the social determinants of identity and migration. 60% of the refugees we talk about, or the migrants of this Arab region, call it Arab region, but I mean of the region in which we live, are Generation Z. That means from 18 to 30 years old. So if we are not convincing each other, how will they be able to convince each other? It doesn't mean anything to Generation Z for me to say, well, I participated in building the Baqa refugee camp in 1967. And when I said, why are we building on the largest water aquifer? The minister said, it's only temporary. So I asked, how temporary is temporary? And here we are today. But I thank you all so much. And I thank Dr. Ferris for her patience with us all. And I thank you all for your patience with me. And I look forward to working with you in the future. Thank you.
Thank you for your provocative comments. I wish we had more time to discuss them and we could talk about Jordan's exemplary response to both COVID-19 and to the refugee situation. There's much to admire here. But thanks to our panelists and to all of our participants for joining us today. And please do take a look at some of these reports, and we'll look forward to continuing the conversation. Thanks, everybody, and bye-bye.